Hi everyone, there is Group 2. In this video, we will introduce how to be a good hemodialysis nurse.
Over 2 million people worldwide currently receiving treatment with or a kidney transplant to stay alive, yet this number may only represent 10% of people who actually need treatment to live. In a world where dialysis patients are on the rise, learning how to be a good dialysis nurse is important. First, we need to understand what dialysis is, how marketers' dialysis methods work.
Dialysis is a therapy that artificially removes wastes from the blood of patients whose kidneys can no longer perform this function adequately. There are two main types of dialysis, hemodialysis and peritoneal dialysis. In hemodialysis, blood is filtered outside the body in a dialysis machine. The patient's blood is pumped to the machine, cleansed, then returned to the body. To prepare for regular hemodialysis treatments, a one-time minor surgery is performed to create a vascular access, which is essentially a large and strong vein enough to sustain the high flow rate through the machine. This can be accomplished by fusing an artery to a vein, forming a so-called fistula, or by adding a synthetic tube, a graft. For emergency treatment, a catheter can be used for temporary access. Once inside the machine, blood flows within tiny tubes surrounded by a dialysis solution, called dialysate. The walls of the tubes act as semi-permeable membranes that allow only small molecules, such as water, nitrogenous wastes, and electrolytes, to pass through. The filtration occurs by osmosis and diffusion, where water and solutes move from higher to lower concentration. The dialysis fluid contains solutes at the levels similar to those in healthy blood. Urea, potassium, and other solutes that are present at higher levels in the patient's blood move out to the dialysate, which is constantly replaced and discarded. At the same time, other substances can be added to the dialysis fluid to be administered to the patient. These may include bicarbonate to adjust the patient's blood pH, erythropoietin to compensate for its low production by the failing kidneys, and certain medications. Because of the increased risks of blood clotting associated with its contact with foreign surfaces, an anticoagulant such as heparin is usually added. The composition of dialysis fluid is typically prescribed by a nephrologist based on the patient's needs. Hemodialysis is normally performed as 4-hour treatments 3 times a week in a dialysis center. Complications include risks of blood infection, thrombosis, and internal bleeding due to the added anticoagulant. The dialysis fluid is introduced into the patient's abdominal cavity via a catheter. The lining of the abdomen, the peritoneum, serves as the natural filtering membrane. The fluid remains in the body for several hours, allowing exchange and equilibrium with the blood running in the underlying vessels before being discarded. The therapy can also be done automatically at night during sleep. Peritoneal dialysis is less effective than hemodialysis, but because it can be performed for longer periods of time, the result is comparable. Peritoneal dialysis offers more flexibility, is better tolerated by patients, and less expensive, but is more often complicated with abdominal infections.
Case report. The male patient, 59 years old, he has serious illness and was diagnosed with renal failure. The patient has been receiving dialysis treatment. It's about 3 days a week. Since dialysis treatment, the patient has developed a urinary tract infection. So we have the question, how to improve the quality of the care with dialysis patient.
Nursing intervention. We should, according to the patient, to education, training, and behavior, introduce to help the patient acquire more dialysis knowledge, and with others, patients share their experience.
Change the patient's healthy diet. Number 2, change the patient's lifestyle and optimize the diet. Adequate intake of the protein and calories, limit the water, and give vitamins and energy. Number 3, psychological care, comfort, guidance, and encouragement the patient. Explain the meaning and the method of the patient. Eliminate the fear and worried about the patient. Number 4, the patient are encouraged to self-care. Take a rest. If the patient have the pneumonia, hypertension, heart failure, and arrhythmia, need to rest in bed. The normal patients are encouraged to be active, improve the physical fitness and endurance. Number 5, dialysis guidance. Explain the purpose, principle, preventive measures, and the cost to eliminate the worries and reduce the panic, the why and the patient, and observe the congestion and dehydration. After hemodialysis, pay attention to the fixation of puncture site to prevent bleeding. The patient with infection should pay attention to the infection control and help the patient to be able to walk and go up down the stair by himself.
Studies have shown that exercise during dialysis improves body function and alleviates depression. Physical activity of long-term patients is generally low. Sports rehabilitation can improve the quality of life and reduce the mortality rate. The next step is to protect the patient's blood access. For most effective hemodialysis, patients need an arteriovenous or graft to provide effective blood flow and thus good vascular access. Infection control prevent complications.
Peritonitis, that is the most common of peritonitis, with the emphasis on preventing infection.
It is important to pay attention to the following points: clean and tidy indoor environment, strict disinfection procedure, change the exit of dialysis tube twice a week, check the skin around the exit for hematoma, pay attention to the personal hygiene of patients.
Asepsis requirements, hemocare, psychological care, and other measures and hemodialysis measures are basically the same.
Peritoneal also requires special attention to the following points. Article 1. Be familiar with the steps of peritonealization and the installation and replacement of instrument pipes. Secondly, pay attention to control the temperature of peritions over fluid, and about 37 degrees Celsius is appropriate. Third, prevent peritoneal infection. Peritonitis is the most common complication of peritoneal dialysis, what directly affects peritoneal dialysis continuity and patient survival. Infection of the peritoneal canal orifices and cavernous can lead to refractory or recurrent onitis and even the removal of peritoneal. The immune function of patients is low.
If the concept of aseptic technique is not strong and the operation is not proper, bacteria will cause inflammation in the external mouth of peritoneal dialysis tube. Preventive measures: keep the dialysis room clean and tidy with fresh air and UV exposure twice a day for 30 minutes each time. Strictly aseptic operation.
Pay attention to the care of the patient.
The exit of the dialysis tube should be changed twice a week, and the skin around the exit should be checked for hematoma, which should be strengthened in case of infection. Keep the bowels open, prevent intestinal infection. Article 4. Prevent abdominal bleeding. Instruct client to protect wound and catheter to prevent local movement or compression of lower abdomen. Article 5. Prevent lung infections. Due to the increased pressure in the abdominal cavity, part of the alveolar dilatation is not complete, easy to be associated with pulmonary infection. Article 6. To prevent abdominal pain. The dialysate temperature is too high or too low, the fluid is poured or discharged too fast, the position of dialysate tube is too deep. The pH of dialysate is less than 5.5 or the high osmotic fluid is discharged, which can cause abdominal pain. The inducement should be removed as far as possible when abdominal distension causes pain at the end of peritoneal dialysis infusion.
In the process of nursing hemodialysis patients, the nurse's duties include: ask the patient's response to therapy and interference.
Asterisk review the patient's laboratory work, home medication, and activities, and inform the physician of changes in the patient's condition.
To help patients follow up with the transplant center, support the entire nursing team in providing quality care in a thoughtful and respectful manner.
Check the patient's vital signs and talk to them to assess their condition.
Asterisk teach the patient about the disease and its treatment, and answer any question.
Asterisk make sure to provide the patient with the correct medication ordered by the doctor.